Good morning, everyone. We're the last group, and today we'll talk about how to properly disinfect dental chairs. First, let me discuss why keeping dental chairs and equipment clean is so important. Why is maintenance or disinfecting of dental equipment important? Well, keeping dental equipment clean and well maintained is crucial because it ensures a safe and hygienic environment for dental procedures. Proper maintenance prevents the spread of infections, promote efficient equipment performance, and contributes to the overall patient well-being. So what are disinfectants? Disinfectants are chemical substances or agents designed to destroy, deactivate, or eliminate harmful microorganisms like bacteria, viruses, and fungi on surfaces or objects. So their primary purpose is to control and prevent the spread of infectious diseases by reducing the microbial load in the environment. The proper use of disinfectants involves following a specific guidelines such as concentration, contact time, and application methods. It's essential to consider the type of surface, as some materials may be sensitive to certain disinfectants. Regular disinfection is crucial in healthcare, laboratories, household, and other settings to maintain a clean and safe environment. However, it's important to note that disinfectants are different from cleaners, which removes dirt and impurities but may not necessarily kill all microorganisms. So using disinfectants responsibly, understanding their limitation, and adhering to recommended guidelines contribute to the effective infection control and public health measures. So which disinfectants are best to use for dental chairs? The choice of disinfectant for dental chairs depends on several factors, including the type of material used in the chair, specific pathogens you want to target, and any manufacturer recommendations. So here are some of the three commonly used disinfectants for dental chairs. First, quaternary ammonium compounds, quats or CACs, high dilution water-based phenolic compounds, and quats plus less than 25% alcohol by volume. So quaternary ammonium compounds, these have been used widely in medicine owing to their antimicrobial properties. They also have a strong permeability, stable performance, low skin irritation, low toxicity, low corrosion, lasting biological effects, and so on, comparing with antimicrobial agents. So at the end of the last century, polymerizable quaternary ammonium antimicrobial monomers had been synthesized and applied in dentistry in order to reduce or prevent microbial biofilm formation on dental material surfaces. Second, we have high dilution water-based phenolic compounds. So this refers to the disinfectants that are composed of phenol-based chemicals and are diluted in water to create a solution for various cleaning and disinfecting purposes. So the phenolic compounds are derived from phenol, which is a chemical compound with antiseptic and disinfectant properties. So the key points about high dilution water-based phenolic compounds include phenolic compounds, which includes phenol and its derivatives. They are known for their antimicrobial properties. They act by disrupting the cell membranes of microorganisms, leading to their inactivation. Water-based formulation. So this is the high dilution that indicates that these phenolic compounds are mixed or diluted with water to create a solution suitable for application. So the water serves as a carrier for the phenolic compounds. So its antimicrobial efficacy. The phenolic compounds are effective against a broad spectrum of microorganisms, including bacteria, viruses, and fungi. They are often used in healthcare settings, laboratories, and industrial environments. Lastly, we have quats plus less than 25% alcohol by volume. So this likely refers to a disinfectant solution which combines quaternary ammonium compounds with an alcohol content of less than 25% by volume. So the inclusion of alcohol in the disinfectant solution adds another layer of antimicrobial activity. The alcohol is often in the form of ethanol or isopropyl alcohol, is known for its rapid and broad spectrum disinfectant properties. So the purpose of it, the combination of quats and alcohol is common in disinfectant formulations for surfaces and equipment in healthcare, laboratories, and other settings. It aims to provide effective disinfection while taking advantage of other strengths of both quats and alcohol.
As for unacceptable disinfectants that we shouldn't use are the following: ethyl alcohol or isopropyl alcohol does not effectively kill bacteria on surfaces but inactivates them, as well as preventing the alcohol from penetrating the bacterial cells to kill them. Number 2, hydrogen peroxide. Because hydrogen peroxide is too harsh to be used on your skin, but it can be used effectively only on hard surfaces such as doorknobs, countertops, porcelain, stainless, and glasses. Number 3, chlorine compounds like sodium hypochlorite. People who are exposed to sodium hypochlorite through inhalation of aerosols causes coughing and a sore throat. After after swallowing sodium hypochlorite, the effects are stomach ache and a burning sensation, coughing, diarrhea, a sore throat, and vomiting. Sodium hypochlorite on skin or eyes causes redness and pain. After prolonged exposure, the skin can become sensitive. Number 4. Sodium bromide. Used only on hard surfaces and exhibit chlorine smell, which may affect the patient's discomfort. Citric acid can't be used because it lacks bactericidal and fungicidal properties, making it ineffective at killing microorganisms. Iodophores or iodine compounds are also not recommended for disinfecting dental surfaces due to their potential cytotoxic effects, undesirable staining properties, and potential allergic reactions for some patients. Ammonium hydroxide or ammonia is not recommendable because it can lead to lime scaling, ammonia odors, pathogen regrowth after a few days, and its effectiveness on feces. Number 8. Most household cleaners are or may contain harsh chemicals that can be damaging to the materials used in dental prosthetics and can have cytotoxic effects on periapical tissues.
Good morning, everyone. I am Marinella Ogduhan. So for the manner of application, the dental chair is the one piece of equipment that all patients will have contact with. So it is very likely to become contaminated with blood or saliva. So over and above the normal surgery and equipment cleaning practices, it is vital to clean and disinfect our dental chair between each patient. So a disposable barrier is always good, but this can become compromised. So proper disinfecting is probably the better option, or we can double up with both. For effective cleaning of the dental unit on a daily basis, it is important to choose disinfectants with appropriate action times, whether rapid or more prolonged, based on the specific requirements of the equipment involved. So, it is advisable to use mild products with a prolonged action effective against organic material, like the high dilution water-based phenolic compounds, the quaternary ammonium compound, Quartz Plus, less than 25% alcohol by volume. The application methods may involve spraying, fogging or misting, wiping, immersing, or even not all method. But disinfecting would not just end by spraying, wiping, or misting only. So aside from using impervious disposable barriers on dental chair surfaces, cleaning and disinfection after every patient is also highly recommended. So after the patient has left the laboratory, it's time to take care of those contaminated instruments and disinfect the unit. Now, the question is, how? So of course, we do not forget to use the appropriate personal protective equipment such as gowns, gloves, and masks when disinfecting dental chairs. So cleaning and disinfecting after every patient is also highly recommended. Now, to use the disinfectant, we simply spray, rub with a cotton gauge or sponge, then wiping down the chair gently, ensuring that the surface stays wet for 2 to 3 minutes. And lastly, after disinfecting the equipment, don't forget to disregard your gloves and masks.
How to disinfect a dental chair and other equipments using UVC. Portable units are placed right on top of the dental chair or equipment to sterilize. Disinfecting towers, which are portable columns that beam UV light into the room for decontamination, are popular in large medical facilities. These products are often on wheels, which can be easily moved closer to the chair to give maximum dose of UVC radiation. However, staff members need to take special precautions in order to use this equipment properly, including not being in the room when it is in operation to avoid possible irritation with UVC. Most products have a delayed timer. It can be set from 10 seconds to a minute. The operator can switch on the UV light and comfortably move out of the premises.
For disinfection schedule, after every patient or treatment, rinse, clean, and disinfect the following after every patient or treatment: suction system and tubes, water supply system and instrument tubes, surfaces, upholstery and instrument tubes, handles at dentist element, operating light, spatoon, and filter cover. Disinfection schedule every morning. Before accepting patients, the following must be rinsed and cleaned. First is water supply system and instrument tubes, suction system and tubes, and spittoon. For every evening schedule, at the end of each day, the following must be rinsed, cleaned and disinfected. First is the water supply system and instrument tubes, suction system tubes, hose connectors and filter inserts, and lastly the spittle. Disinfection schedule as needed is firstly control the air filter or turbine, clean and replace silicone pads, clean and disinfect cup filler and cup rest, clean and disinfect instrument holder, and lastly, change the amalgam separator. And lastly, the disinfection schedule for weekly or after a long downtime is to clean and disinfect instrument tubes, water supply system, suction system, and spittoon.
Do's in disinfection of the dental chair. Cleaning and disinfection of the dental chair every patient is recommended. It is necessary to disinfect the dental chair every after patient. Professionals who are looking for more ways on how to disinfect a dental chair are now considering the use of enhanced measure. One effective technique is the use of ultraviolet light. Next, an EPA-registered hospital-grade disinfectant should be used. Other chemicals may stain the upholstery part of the dental chair. Also, some brands of dental chair only allow specific products to clean their products. Next, electrical switches in the chair must be covered during disinfection. Chemical solutions may damage the unit or cause an electric short in the switch if not covered. Next, use of heavy puncture resistant nitrile rubber utility gloves when cleaning. Using of the proper kind of gloves may prevent and reduce the chance of direct contamination of the hands. Surfaces that are difficult to disinfect must be covered with plastic wrap. Surfaces that are difficult to disinfect, such as chair buttons, control buttons on the air water syringe, switches on the unit, light handles, hose and handpiece, and air water syringe holders. It takes less time to replace a cover than to disinfect the uncovered surface between patients.
Don'ts. Do not use chemicals such as ethyl alcohol or isopropyl alcohol greater than 25% by volume, hydrogen peroxide, chlorine compounds like sodium hypochlorite, strong phenols or phenyl alcohol combination, sodium bromide, citric acid, iodophores or iodine compounds, ammonium hydroxide or ammonia, both household cleaners, so that harm can prevent in the surface of dental chair. The second is do not forget to use the appropriate protective equipment such as gowns, gloves, and masks when disinfecting dental chairs to protect sensitive parts of the body such as eyes, skin, and respiratory system from coming into contact with disinfectants. The third is do not forget to rinse, clean, and disinfect the suction system and tubes, water supply system, and instrument tubes, surfaces, upholstery, and instrument tubes, handles at dentist element, operating light and spittoon, and filter cover after every patient or treatment to prevent the spread of infection or bacteria to the next patient and the dentist. The fourth is do not accept patients every morning unless the water supply system and instrument tubes, suction system, and tubes spittoon are rinsed and disinfected to ensure that it is clean before using it on the patient. The fifth is do not forget to rinse, clean, and disinfect the water supply system and instrument tubes, suction system, tubes, hose connectors, and filter inserts and spittoon, following at the end of each day so that the dirt doesn't last long and to be clean and prepared the next day. The sixth is if a product does not have a delayed timer from 10 seconds to a minute, do not use it right away to prevent irradiation with UVC.